Welcome to my channel, Dr. Devendra Sera Show. And the topic of discussion today would be post-delivery blues. You may be suffering from postpartum thyroiditis. I'll be very short in this presentation and I shall be answering all the questions which have been asked following my presentation in Hindi. The first question is, what is postpartum thyroiditis? Postpartum thyroiditis is a condition which is because of autoimmune process and which tends to occur after delivery in a lady who has delivered a child and starts after 3 to 4 months. Initially, there's a period of overactivity of thyroid when the person feels weakness, ghabrahat, bechani, can get some loose motions. It is followed after a month or so by a normal phase, which is followed by a phase of underactivity of thyroid, which is characterized by symptoms of weakness, lethargy, depression, etc. Then, why is it important? It is important because about 10% of ladies in India may get postpartum thyroiditis after delivery, and it is manifest at about 6 months after delivery, and it is generally confused that the lady is worked up because of birth of the child and is managed sometimes not rightly by giving her antidepressants, whereas she actually is suffering from postpartum thyroiditis. Why does it occur? Postpartum thyroiditis occurs because of an autoimmune process. It is a variant of Hashimoto's thyroiditis. Ladies have generally higher levels of anti-TPO, and anti-TPO antibodies are present in the blood, and normally they do not manifest as under or overactivity of thyroid otherwise, but after delivery they manifest after 3 to 4 months, because pregnancy as such is a protective state, and after delivery many diseases which were occult or which were not manifest may get manifest. We have also seen as physicians that many tuberculosis patients develop resurgence of tuberculosis after delivery has occurred. Similarly, this disease of postpartum thyroiditis tends to occur in those ladies who are susceptible and who have higher anti-TPO antibodies after delivery. What are the symptoms? Symptoms in these patients initially are the symptoms of hyperthyroidism, which may be confused with restlessness, bechani, or otherwise. But later on, after 6 months of delivery, the symptoms are of hypothyroidism. The typical symptoms of hypothyroidism are uh, some hairs fall, confusion, weakness, lethargy, slow mental acuities, inability to get up in the morning, sleep disturbances, most important, mood swings, which are often confused by overstress in the lady who has given birth to a newborn. Now, treatment. Treatment requires symptomatic treatment initially in the first phase when the lady has symptoms of hyperthyroidism. That is, if pulse rate is high, we give beta blockers. And we keep on following up the patient for a few days. And when symptoms of hypothyroidism occur, we get TSH done. And if thyroid TSH is more, then we give some amount of thyroid supplements. And they are to be continued for about 5 to 6 months. After that, the lady turns into a euthyroid phase. Now, a very commonly question asked is that is it serious? Generally, it is not. Generally, all the medicines stop after 1.5 years of delivery, and most of these ladies return to a euthyroid state. However, in a few patients, we have to continue with the thyroid supplement, and your doctor would be the best judge. So I wanted to make this video so that this confusion after delivery, when the nursing mother is feeling weak, feeling depressed, it is taken that it is because of stress, whereas it is not so. It is a physical disorder, and we all must know it. And if you have any relation who has such type of problem, you kindly share this video with her. And in case you like such updates, kindly subscribe to my channel. Thank you so much.